question. Talk a little bit about the risks that an organization or really that your organization is seeing out there in the market today with regard to this changing workforce and the dynamics around it.
Yeah, so I mean, I think from a security and IT perspective, there's really three major risks that we're seeing. I mean, obvious is the cyber threat surface has really dramatically grown. The bad guys, know how to cash in on a good pandemic, right? And so we're very aware of the targets and sort of the expanded surface. Everyone works from home. We're all using new technologies to try to just get our work done. And so that certainly opened up a lot more opportunities. I think also you've seen, in where we've literally put people, entire almost organizations in a remote posture almost overnight. Security is now trying to catch up on a lot of those cases. So there's certainly more vulnerabilities across our environments. And then I think you look at things like phishing. It's nothing new, but the context and how the bad actors are using that to lure in so those unsuspecting users. And in fact, spoofing and leveraging a lot of our well-known healthcare brands and government entities, to try and capture credential information or inject malware. I think is interesting that I read Google reports. So in January they counted somewhere around 149,000 active phishing sites, but by May there was 840,000, and largely those were focused on COVID-based premises, so PPE and those kind of things. So a lot of activity in trying to steal credentials and inject malware. And as a result, we've seen definitely a large increase in ransomware. And ransomware is really nothing new from a healthcare perspective. We're seeing across all facets of the industry. You see headlines as early, as late as last week around nation states hacking into research facilities. So there's a wide array of sort of direct impacts from a pandemic perspective. Related, I think, is also, we talk about the remote workforce. That certainly has increased our security risk. I think it was yesterday, or the day before, I was reading a study that looked at the difference of cybersecurity between a corporate network and a home network. And home networks, they found they were able to measure it roughly about 3.5 times more likely to have at least one form of malware on them. So you think about that, and your entire workforce is at home and using their own Wi-Fi routers and various states of password 123 as their password, or maybe no passwords at all. Certainly expands the opportunity for the bad guys. And the third area, I think, is a direct result of COVID and how we're adapting is the rapid adoption of technology. You think just telehealth as an example. Telehealth wasn't new, but the massive expansion almost overnight to be able to provide services to patients, vitally important. But navigating the security vulnerabilities and trying to understand the various platforms, and also data security and data privacy issues has been a challenge. So we're seeing organizations start to address those pieces.
I mean,